having seizures, can I still drink and smoke?
When we talk about mixing a seizure disorder with alcohol or smoking, be it marijuana or cigarettes, what we try to keep in mind is that you have something called a seizure threshold, and that is the set point at which your brain will go into a seizure. It's maintained high by nature in terms of the getting good sleep, good nutrition, keeping fit, and taking your medication, which all serve to raise your seizure threshold. And it's lowered by any substance that acts on the brain. So many common drugs that are taken for other conditions can lower your seizure threshold. Alcohol, of all of the things that you might think of, lowers it quite dramatically and quite effectively. So if you drink alcohol, you're putting yourself in harm's way and putting yourself at pretty much high risk for having a seizure, even if you're on your meds, because it's a powerful seizure threshold lowering agent. Other drugs also, if they affect the central nervous system, can serve to lower your seizure threshold and again tip the scales to favor having a seizure. A lot of times people stay up late when they do those sorts of activities, and that sleep deprivation is another additive effect as well. I think the smoking of cigarettes is probably to be avoided for other health reasons, and for many other reasons it's a good idea not to get into the habit of smoking cigarettes, but they probably don't have much bearing on seizure threshold particularly, or on seizures. They just have other major health problems associated with their use and the addiction to nicotine, which is hard to kick. The other drugs that you might use, again, it would be a matter of what effect do they have on the seizure threshold to determine what effect they might have on your using them and having epilepsy. And in general, avoid them if you can, because it's not likely that they're going to have a beneficial effect on your seizure threshold. Marijuana is often laced with other substances, and those other substances are often stimulants or medications that do suppress the brain activity and cause the seizure threshold to plummet. So you may think that you're smoking marijuana or having marijuana, and it may be that it's super strong because it's been laced with something else. By itself, when they've looked at marijuana, it tends to cause low blood pressure more than it causes lowering of the seizure threshold. But for some people the lowering of blood pressure can predispose to seizures. And for some people, the sedation effects of marijuana, the making them sleepy and drowsy, getting them into that state, may predispose them to seizures, because the sleep state and the drowsy state is, again, associated with a lower seizure threshold than the awake state. So for those reasons and many others, it's probably a good idea not to mix the two if you can help it.